When I was growing up in Oakland as a young black boy, we didn't know that we would make it to 18 years old or 25 years old without either being shot or in jail. So those were the big party times, 18 and 25. If you made it to those birthdays and you weren't in jail or dead, then you made it. And so when you live like that, HIV is not a big deal. Like something else is going to kill me. HIV is not what my number one concern is. I'm concerned if I'm going to make it home from school tomorrow. I was a teenager in the 80s, right across the bay from San Francisco. So I used to see the HIV epidemic on television, on the news, on the evening news all the time. I would see something about HIV. I was aware, but I didn't think it was a problem that I ever needed to be worried about because it was all gay white men in San Francisco. I didn't know any black men who were openly gay in the 80s until I started losing folks from my life, like a couple of choir directors, a tenor in our church choir. We may not have been present on the TV screens in the big protests, but we were taking care of community, right? That's what black folks do. It's like, okay, we don't have the we don't have what they have. Let's figure out how to get it in our communities. Let's figure out how to take care of ourselves. Where I'm from in Oakland, Dr. Robert Scott started AIDS Project of the East Bay in 1983, a year after San Francisco AIDS Foundation was started. And it was because San Francisco AIDS Foundation was started at 82 and was giving kind of educational information to the white gay men in San Francisco that Dr. Scott looked in his backyard in Oakland and said, well, there are black men that I'm seeing in my clinic and they're not getting the same information that the white guys in San Francisco are getting. Oakland was an afterthought. In the HIV world, we talk about it being a shadow city, a city that's in the shadow of another bigger city that's getting all the attention and all of the resources. And you have the same things today. We're still talking about the same things. It's because there was a head start. And it feels like there's always a head start. That's what white privilege is. It's a head start. Black women have spoken for black men when black men weren't able to speak, right? When black men couldn't be out and proud and gay or were too sick to be out, it was black women who were the loudest voices and advocates for black men. Unfortunately, that's not often reciprocated. So the heterosexual men that I have encountered doing this work feel sidelined, feel like an afterthought, feel like all the services are geared towards gay men. Where do I fit in? I remember speaking to a veteran who was exposed on the battlefield and had never publicly said anything about his HIV status because of the stigma, like this war veteran, heterosexual man, but he was living with HIV and he couldn't tell anybody. So I think a lot of heterosexual men kind of have that, I can't really be out with my HIV because people are gonna think I'm gay. I think as you move forward today, there are more black men that are involved in the movement. And so black women, rightly so, I think, focus more on women's issues than black women's, women in HIV. In the beginning, everybody thought it was just a gay men's disease. But we knew that there were women, even in the 80s and 90s, testing positive for HIV. And so women have always been the backbone of every struggle. Trans women have been amazing. Again, it's one of those unreciprocated loves for community. Trans women put their lives on the line, and they're often the loudest voices, not just for trans issues, right? They're shouting for everybody. And so, there's a lot of credit to be given to women, cisgender and transgender women in community. It wasn't that black folks wanted to create the black church to be separate. It was because they weren't allowed to be in integrated churches. So the black church was a place where folks who were powerless Monday through Saturday could have some power on Sunday and could be themselves. And it's also a place where we build our communities up, right? Churches are a social safety net for the community. They're a center of power for black folks. And traditionally have been a place where black communities have been influenced. Whether you go to church or not, you are influenced by the traditional black church of the United States. And so when people of faith thought about HIV as a disease that was affecting homosexual men, then it was easy to go to Leviticus and say, well, man shall not lie with man like man lies with woman. And so the black church stood on that for a long, long time. And there are still lots of black churches that believe that and preach that, and it's coming from a place of authority, right? There's a power dynamic between the pastor of a church and a congregant. And I think probably people listen to the pastor more than they do their doctors. So when your pastor is telling you that something is wrong, then it's kind of hard not to believe it. One of my mentors, Reverend Horace Griffin, wrote a book and he put in there, the black church perfected Don't Ask, Don't Tell long before the military ever did, right? It was unspoken. Everybody knew that choir directors and men that were singing in the choir, artistic folks, Sunday school teachers, kind of these gentle men, some of them were gay. It was fine in the church as long as you didn't flaunt it, as long as you weren't flamboyant, as long as you didn't bring your boyfriend to church. And that's what created a lot of the problems in the early part of the epidemic. I think today there are more welcoming congregations around, that, so people have a choice. And there's a movement of progressive black faith leaders that kind of are preaching something in new ways that is more accepting and more the faith of the Jesus that we profess to follow. By the time I tested positive for HIV in 2005, I had worked in the field already, right? I had been working in the field for about 6 years already. So I kind of knew, but I think also it was kind of inevitable. Like if you're gay, you're gonna end up with HIV at some point, period. And even with all the education that's out there, when you first test positive, you still think you're gonna die. Like that's the first, okay, so when am I gonna die? How long do I have? And if you're gonna die and you haven't been married or had kids yet, then, oh, I'm never gonna get married. Nobody's ever gonna love me. I might not ever have sex again. I'm not gonna have any kids. My parents are gonna be disappointed. I might get kicked out of the church, or they're gonna make me stop teaching their kids in children's church. There's all kinds of things that could happen, and all kinds of things do happen to lots of folks. Like I'm blessed from being from progressive California with a understanding family and an accepting church home, but I know folks that has not been their experience, right? The first person I talked to was actually an assistant minister at my church, which is not normally, I went to the black church first, and she prayed with me and supported me. I told my mother not long after I told the minister at the church that I tested positive for HIV. My mother worked in healthcare her whole career, and I think the first thing she did was go to one of her friends at the hospital where she worked, a friend of hers who was living with HIV, to figure out how she needed to handle it. So, and she was like, okay, who do I need to call? What do you need? But we're gonna do this together. I think in my experience, I don't know that black folks necessarily feel entitled to healthcare. I think I was having a conversation not long ago about mental health, and one of the things that came up in that conversation was, a lot of times we think that's something for rich white folks. That's not something that we can do. We can't afford to take that, that's a luxury. Preventive healthcare is a luxury. And I think we are so used to waiting until a limb is about to fall off to go get help, because you can't miss your job, you can't miss a check, you can't not pick up the kid from, there's so much other stuff going on in your life that your health, unless it's absolutely dire, is on a back burner. I think one of the biggest challenges facing the black community around HIV and AIDS in 2022 is getting it back on folks' radar as an important issue. Racism has always been an important issue, right? So folks are worried about police brutality and mass incarceration. And now over the last couple of years, folks are worried about COVID-19. So HIV keeps moving down on the list of priorities for black communities. The overall numbers in the United States look better year over year, but when you get behind those numbers, you realize that it's gotten better for white gay men, and it's not gotten better for black and brown men, or black and brown women, or transgender folks. And that message doesn't get out to the general public. I feel like often when we talk about the epidemic, we're preaching to the choir. We're talking about folks already living with HIV, and we're talking to folks working in the field. And I think my hope had been that with more folks engaged because of COVID-19, more folks kind of paying attention to biomedical research, we could capitalize on that for the HIV movement. My fear is that COVID is just going to last too long, and folks are going to think forget about HIV again. So I think, yeah, one of the biggest challenges is making it a priority for Black folks.